Good evening, good evening, good evening, everyone. Good evening, good evening, good evening. Blessings to each one of you that are listening in and joining in with us on this night's service. This is Wednesday. And of course, if it's Wednesday, it must be Word Wednesday. We praise God for you that are coming on. And what a exciting and interesting um, Word Wednesday this is going to be. We make every attempt to minister to the whole man. We minister holistically to spiritually, of course, first and foremost, and then also even to the mental, physical, emotional aspect of our being, because we are tripartite creatures. We are made in the image and in the likeness of God, and in being made in the image and likeness of God, we have needs that go across every realm of our existence, spiritually, physically, socially, educationally, or intellectually, emotionally, and mentally. So I'm excited tonight that you're joining us. And we have in store a wonderful, wonderful treat, an inspiring and informative um, um, hour tonight on our Word Wednesday. I welcome you. I see you coming on. God bless you, Sister Renee Pointer. Bless you, Missionary Kim Calhoun. Love you. We thank God for you, Sister Smith. God bless you, Sister Felicia Moore. I see you. I see you. God bless Sister Michelle Smith. I see the saints are coming in. God bless Sister Marva, Sister Crenshaw, Missionary Patterson, Gail Patterson. Pray and trust that you're doing well and hopefully back with us. My son, Nick Savard, all of you that are coming on tonight. May the blessings of God be upon each one of you and with you and your particular households. What a joy it is tonight to assemble together to receive um, both biblical and practical information as relates to the coronavirus, this pandemic that we're in, and more specifically as relates to the vaccination information. We're living in a day and time when there's so much misinformation out there. I wanted to do all I could do to properly inform and give factual, verifiable, both biblical and scientific knowledge. And so we're grateful tonight that you're joining with us. We're blessed tonight to have with us um, a medical doctor that serves in our community, that looks like us, that's been well trained and received her schooling and her credentialing and her academic preparation. And I want to bring forward into the forward front of this session Dr. Cheryl Moore, as I just articulate a couple more um, interesting tidbits from her dossier or resume. Um, Brother John, Brother Lundy, if you just bring forth Dr. Cheryl Moore on the screen, and we want to welcome her to Christian Gospel Center, Church of God in Christ. We're the loving, teaching, training church. Dr. Moore, what a joy it is to have you with us tonight to share and impart unto the people of the Lord and those listening via Facebook Live and YouTube this most pertinent and needed and applicable information concerning the reasons why we should be vaccinated. And then I want to say to all those that are dialing in tonight, get your questions ready after Dr. Moore speaks to us with what she would like to share. We certainly will save time and give opportunity for you all to ask questions, and Dr. Moore will do the best within her wherewithal to address those questions. Dr. Moore is a certified practicing internist. Ever since 1989, about just a couple of days ago, probably about 31 plus years or so, she is on staff. She's a practicing physician in the DMC systems of hospital of health systems. Our own missionary Carol Walker was very instrumental in making the connection. Actually, Dr. Moore has been with us before. This is not her first time with Christian Gospel Center. She has imparted most valuable information with us and to us before at other times. She's a graduate of Wayne State University Medical School, where, of course, that's part of my alma mater, not the medical school. Mine is in the other school. My wife's graduate school of choice from the law perspective. So we're both alumni or alums of Wayne State. So I'm glad to welcome this noted and revered person. She also is a believer in the body of Christ, certainly loves God, and is a practicing and viable and participating member of Plymouth United Church of Christ here in Detroit that all of us know very well. Very active, very community-oriented church, very renowned church under Pastor Hood there, and even succeeding his father, the late Dr. Nicholas Hood. So let's receive now. I'm going to decrease and kind of just bring to the forefront Dr. Cheryl Moore, who is a diplomat of the American Board of Internal Medicine, and she will share with us. Get your pens ready, get your pencils ready, take notes. Matter of fact, why don't you hit the like button? Hit the like button, hit the share button, call, let someone else know that this is a most important time for them to be on, to be imparted, to receive the information that she's going to impart into us on tonight. Welcome, Dr. Moore, and we're certainly glad for you acquiescing to be a part of our Word Wednesday tonight, and we're going to put it into your hands, and thank you for your willingness to be a part of this information exchange. I'm going to decrease. John, you can actually.
Good evening, Christian Gospel Center. I'm Dr. Cheryl Moore, and I thank you, Pastor Ways, for allowing me to dialogue with your congregation about the coronavirus vaccine. As Dr. Ways has said, I am a native Detroiter, and I'm deeply invested in keeping our community safe and healthy. I am an internist, a doctor for adults, as most of you know, right here in Detroit in our communities, where I've served really for all of my career. I'm not an infection specialist. I'm not a researcher. I'm really your family doctor, hopefully the one that you trust, that you see for your general medical problems, hypertension, diabetes, or just whenever you're sick. My role tonight, and as it has been for all the years I've practiced, is to educate you by providing you with accurate information about the vaccine, try to dispel myths and misinformation where possible, dialogue with you, as I hope that would be the great majority of this, my meeting you today. Hear your concerns and your comments, and to help heal our communities one person at a time. That's sort of my motto for practicing, and I hope it will carry over to this chance tonight to speak with you. So as we get started, when speaking with Pastor Ways about coming here tonight to speak with you, he told me that he has been teaching and preaching on the topic of love thy neighbor, which really touched my heart, and it's where I've been. It's been a perfect scripture to build on. I felt like all along since we've started this pandemic, started being part of the pandemic, that we really should think of this, or how we manage it, what we do, our decisions about how much of a part of we want to take part in prevention has to be about someone other than myself. So pretty much every day I hear people say, well, I don't need to do this because I'm this. I don't need to wear a mask. I don't need to have the vaccine. I don't need to social distance. I can travel. I can go anywhere I want. I can do everything. The problem with that approach is that it's all about you. Well, as we can see, and as the pandemic has shown us, it's not all about us. It's about all of us. And if we take that approach into how we approach the vaccine, our behaviors, and our stance on where we are on different recommendations, we will survive. a lot better. So I'd like to start out by saying that I am a proponent of most of the recommendations, especially mask wearing. I think it's very simple. It's something that's very easy to do. Masks have been and still are being made available to us. And if we do nothing else, I would ask that all of us continue to wear our masks to protect ourselves and our community, once again, from the coronavirus. So you say, well, what is our community? Well, everyone has a different community. For me, my community is obviously my family first. I am a practicing physician, so my community includes my staff, other physicians that I work with, and it certainly includes the patients that I see every day. So I would never want to come to my office and infect anyone, and I am certain that all of you have been places where you wondered, would I be infected if I go there? So once again, I'm back to love thy neighbor as you would love the Lord and as you love yourself. So be mindful of your decisions to participate or not participate based on that teaching. It's one of the best and it works perfect for us in this setting. I thought a little bit how I would present the information to you tonight, and I thought we might start out with just a coronavirus vocabulary. Since the coronavirus has been a part of our lives, there's been so much discussion about many aspects of science that we've all had to learn new words, what they mean, how they pertain to us, and how they are important. So I actually would like to start out very simply, and most of you probably are familiar with these terms, but I thought we'd start together so we would know exactly what each other is speaking about. So we walk around all the time talking about COVID-19. So what exactly is COVID-19? Well, it is an acronym actually for coronavirus disease of 2019. So that's where the letters come from. It is the actual disease that's caused by a coronavirus, which is the SARS-2 virus, which stands for severe acute respiratory distress syndrome. And that to say that most of the disease has been traditionally related to the respiratory system. A second vocabulary that I'd like to talk about is herd immunity. So herd immunity is something that's been talked about since before the vaccine came out. So what it means is that a large percentage of a population would be immune to in this case, the coronavirus, such that those who are not immune would not be able to get it. Now, in order to get a large population of people immune to the infection, we would either have to have many, many people get the infection, develop an immunity, and then survive the infection so that we could have at least 70 to 84% of the people in that position. And then the other people who were not immune would likely not get it because there wouldn't be that many people who didn't have it. However, that is a very risky way to get herd immunity. And the safer way to get herd immunity is to vaccinate the majority of the people. And then there would be very few people who didn't have immunity. And so those who weren't able to get immunity for medical problems, or if they're not able to take the vaccine, then they could be safe out with the herd because all the rest of us are immune. So that actually, herd immunity is not a new concept, and it's been around for years. And the safest way to reach a herd immunity in any population is to vaccinate. Natural immunity in this country, which would come about as I said before, with having the infection, would take about 70 to 84% of our population. That would be about 200 million people would need to have the vaccine. Have the infection. And we know what kinds of problems that would cause with healthcare, with overburdened hospital systems, overburdened employees, and the use of critical resources and equipment. So the better way would be to get vaccinated. The vaccines that we've talked about, I hope everyone is familiar with what a vaccine is. I'm sure most of us are. So a vaccine is a way of creating immunity to an infection or potential infection without having to have the actual disease. And most of us were vaccinated as children with MMR, which we know as measles, mumps, rubella. Some people have been vaccinated against hepatitis. Others have perhaps been vaccinated against the flu, pneumonia, shingles. So vaccines have been around for a long time, and obviously this is not a new concept. And so most of us are very familiar with, how the vaccine process works. Another piece of vocabulary I thought we should talk about is, what is mRNA? We know that two of our vaccines, Pfizer and Moderna vaccines, are created with mRNA, which stands for messenger RNA. So indeed, what mRNA is it is an instruction. So what happens is you get the vaccine, this instruction goes into your muscle cell. The cell then takes the instructions that tell it to make a piece of protein that is part of the coronavirus. That part of it that is made by your own cell then will create or tell your body, this is a foreign object, this is a foreign matter. And so your body will then make antibodies to it, and that's how you become immune. Once the instructions are given, the instructions are destroyed by the cell itself. It's no longer needed. All of the information is kept outside of the nucleus. And I know this is getting a little scientific, but the point I want to make is that the mRNA never goes to your DNA. So it never can alter your DNA and change the DNA that you have, which makes you unique. Those are what mRNA stands for. We do have another kind of vaccine made by Johnson & Johnson in this country, and other countries have their own these kinds of vaccines, which are called viral vector vaccines. This works a little different. I'm not sure if you're familiar with that concept. The viral vector, that's another vocabulary word that's being thrown around a lot. The virus is, so we take a virus like something that's harmless. So they used cold virus. They use it to sort of carry the information that your body's going to use to make the antibodies into the cell, once again, into the cells cytoplasm, which is where all the information takes place, which is where your DNA is not. So therefore, your DNA, or how you are uniquely made, is never interrupted or comes into contact with any of the vaccine. Once again, the cell then makes a little piece of protein. Your body recognizes it as a foreign agent, and you make an immunity. And once you receive the appropriate shots, 1 or 2, depending on the vaccine of your choice, then in 2 weeks you should be immune. We can, people can ask questions about all of these things, and I won't go into really about how the vaccines are made. Hopefully that'll come up in the question and answer portion, as this is supposed to be a dialogue, and I'm hoping for loads and loads of questions and reasons to help us, all of us, to help each other to dispel some of the myths around getting the vaccine. Another vocabulary that I'd like to touch on is this Delta variant, and that's the one that we hear the most about. However, there have been many, and there are many more that are being found out about and studied on a daily basis. A variant just means that the virus has mutated. And you may know about mutations, and it just means that the genetic coding has been changed. Now, every mutation that the virus makes is not for the worst. Sometimes the mutations makes the virus less aggressive and less contagious. However, in the case of the Delta variant, that has been the exact opposite. It is a much more contagious variant of the COVID vaccine. It is actually easier to spread. It is the prominent strain now of infections in our country. And our greatest concern is for those who are unvaccinated. Now, most of the people who are getting, not everyone, there are breakthrough cases, but most of the people who are getting the infection now are generally, and nothing is 100%, are generally people who have not been vaccinated. So the reason why the vaccine is important in terms of the variants and what you need to know about them, for the most part, is that they are mutations of the same virus, is that the more infections that come, more people who are infected, the more chance that the vaccines will mutate. So how do we stop the vaccine from mutating? We don't let it continue to infect people. How can we do that? The same things we've been doing. Don't get the infection. Don't pass it to other people. Every time there's a new infection, a person who's newly infected, there's a chance that the virus, we're giving the virus more chance to mutate. And the virus is actually fighting us. It's trying to stay alive as well. So any chance it gets to make a change that perhaps our treatment and or vaccine does not cover, then we are once again vulnerable to the ravages of the COVID vaccine. The COVID infection. Vaccination obviously can prevent further infection, which prevents further mutations. So really this whole concept feeds on each other and helps us to protect ourselves. There have been questions. I think that's it for regular, for the vocabulary that I came up with that might be important, but hopefully people have other questions about explaining some of the words that or concepts that you might be interested in, and hopefully that'll take place in the question and answer session. So there's been a lot of talk about the vaccine and how it was created too quickly. And if you're not in the world of medicine or in research, you may think that could be the case. There have been people working for decades on coronaviruses, not this coronavirus, but coronaviruses as a whole classification. They've been working on vaccines for the common cold for, as I said, decades, which is a coronavirus as well. The difference is, because this is such a global problem and has been a global infection, which is why it is called a pandemic, there was more collaboration than you can imagine between pharmaceutical companies, biotech companies, American scientists, international scientists, our government, foreign governments, who collaborated to come up with all of these vaccines, exchange of ideas. There were open lines. If you could even imagine the resources, the employees, the financing, and just the open doors and green light. So it really shows you how things can be done when everyone is working on the same products. And we didn't start from zero. As I mentioned, many scientists have been working on this coronavirus vaccine for many years. And so we actually had a head start on how to create it. I would also say that the usual processes that take place to approve vaccines and other medical products did take place with this vaccine as well. So I would not say that that will make everyone comfortable with how it was done, but I do, in my reading and the information that I have, feel that the processes were followed and that the stringent criteria that our FDA usually uses for okaying and agreeing to have products out have been followed. So just wanted to get that out there. I'm sure there'll be a lot of questions or comments even, and I'd love to hear all of them regarding that issue. I hear that a lot in my office, so I know that that is a problem, and hopefully you can help me with better able to and explain it to my patients, and hopefully I can help you with answering some of your questions regarding how the vaccine came about. So some of the other things that I've heard about myths, and I will say that the myths that I know of are just the ones that are brought to me by my patients. And I would like to comment on, say a few things about those. Number one, there is no metal in the vaccine at all. The vaccine is purely the mRNA viruses or the vector virus, as the mRNA kind of vaccine or the vector kind of vaccine. Of course, it has inactive ingredients. One of them is called PEG, which is propylene glycol. And any of you who have had a colonoscopy is familiar with that product because it's the main product in the bowel prep. Of course, there's other sucrose, which is a sugar, cholesterol, and things are in there to make the product work and to help it, how should I say, to help it maintain its liquid state, and also to help it be preserved so that it can be given out at different times. The you're not given any part of the coronavirus when you receive the vaccine. And once again, the vaccine, the way it's made, it never has anything to do with altering your DNA. So I hope that's one of the things that we can dispel with this particular program today, that we can concentrate on other issues regarding the vaccine, and not think that it will change us and how we're made, and our unique and our uniqueness. The last thing I want to touch on before we start with the questions is just talk a little bit about the side effects of the vaccine. I think most people who've had a vaccine are aware that you can have just local reaction, which is expected. Some people have had no side effects whatsoever, and some people have only had the local, their muscle is sore. That's pretty much with any vaccine. It may be a little warm, it may be a little red. I have seen one person who actually had a what I'm going to call a cellulitis, which is an infection of the skin. We treated her with antibiotics, and she did fine. There was no other problems. And then the biggest potential side effect, I believe, is a true allergic reaction. None of the vaccines have any eggs, and that was one of the bigger issues at the beginning, I think, with a lot of people. Not made with eggs. There's no latex. Once again, there's no metals of any kind. But I would suggest that if you have had severe allergic reactions in the past, that you seek the information from your own personal physician about whether you should receive the vaccine or not, and exactly how you should go about it. A severe allergic reaction is described as one that requires you to have epinephrine or seek medical attention. Severe does not refer to you got a rash, even if it's urticaria or what you might call whelps. That's not considered a severe allergic reaction. So you would still be okay to have the vaccine should you just decide to get it. The more severe potential side effects from actually any vaccine is a diagnosis known as Guillain-Barré. It's very rare. We have seen it with other vaccines as well. And it is actually a neuropathy, which is a pathology of the nerves. So the nerves are damaged. The resolution is good. People recover from it fully. And as with anything else, of course, it's not 100%. The chances of getting that would be very low. It has been one of the warnings from the Johnson & Johnson vaccine, but really any vaccine that you get, it's a potential for that. Certainly one of the most devastating potential reactions to the vaccine was the central venous thrombosis. And that was the clots that you may be aware of that occurred. And I believe initially early on, I think it was about 6 women between the ages of 35 and 50. And then later on, I think there have been a total of about 28 cases, and some of them have been men as well. So what's been said about that is that their vaccine, Johnson & Johnson, still considers it safe because you had 28 people out of about millions of people who received the vaccine who nothing happened. So as you look at all the vaccines and the potential side effects, it's like anything else we do. There's a risk stratification, or you decide how much risk you want to take. Is your risk high to get corona, the actual disease? Would you be sick if you got it? And would you survive if you got it? And those are questions you have to ask yourself, and then you have to decide how you getting it or not getting it affects other people's in your community, which would maybe include your grandmother, a good friend who has some kind of immunologic disease, or a cousin who got a kidney transplant. And those are people who may or may not be protected against the coronavirus. So you might consider them in considering your pastor's theme, love thy neighbor. So I think I'll end there, and I'll look forward to your questions. I appreciate the pastor giving me the opportunity to speak to you, to dialogue with you. I'm hoping to learn from you and have something, perhaps to take back to my patients as I see them. And once again, we'll turn it back over to the pastor, and we'll take it from there. Thank you so much.
God bless you, Dr. Moore. Thank you so much. What valuable information you have shared in a snippet nugget of time. Thank you again for so clearly and effectively communicating in terms and language that we certainly can comprehend the definitions, and you have certainly educated us. I'm going to encourage, while I'm talking, our listening audience, if there be anyone that has a question, I'm going to encourage you to use the comment area to post a comment or a question, and we will field and get those questions answered and addressed to Dr. Moore. While she's doing that, she's also has a private practice, and she is again a part of the DMC Detroit Medical Center system of the healthcare network. But she has her own private practice at 6001 West Outer Drive, 6001 West Outer Drive, Suite 205 in Detroit, which is just not far from here. 313-966-9521. All right. That's again, area code 313-966-9521. So feel free to reach out to her. She's right here in our really immediate area, just at Outer Drive at 6001 West Outer Drive in suite number 205. First question, Dr. Moore, that arises is from Josephine Austin. Some feel if they had COVID before, they don't need the vaccine. Can you address this issue?
So that is actually partly true. If you have had COVID, you will have antibodies perhaps for 90 days, so about 3 months. And then after that, your antibodies will wane, and then you will no longer be immune to the coronavirus. Now, the other issue that arises with people who've had the COVID infection is that they can get it again. So if you don't have any antibodies, you can certainly catch the infection again. And so we are encouraging those who've had corona to wait their 90 days and then be vaccinated with one of the approved vaccines. So actually those people who say, well, you said some feel, Ms. Austin, I am agreeing with them to a certain extent that they don't need the vaccine, but they will eventually get it. So maybe we can think about it like this. So let's say you had the flu this year because you didn't get the vaccine, or you got the vaccine, but you were what we call a breakthrough case. It certainly doesn't mean that you can't get the flu when the flu season comes again, which is why we give the vaccine every year, because your flu antibodies, they don't last long enough. So hopefully that answers your question. If not, please feel free to re-enter any other comments you have about that issue.
Dorothy Powell says there have been stories of individuals dying or being found dead, sometimes after receiving the vaccine. Could you expound on that, please?
I think that is very difficult to talk about as a whole. I do know some of these instances. I would have to wonder what I want to say, what kind of patient, but that's not how you think. But so, what were the person's other problems? Did they actually die from the vaccine? Were they a person who was already ill? I mean, there's so many questions to be answered regarding that. But I do know of cases, and I don't have the well, first of all, I don't feel I have the expertise to decide if they really died from the vaccine or not. Like I said, I think each case would have to be investigated on its own. The cases that I know about of people who were found, or who died, or who found dead, was an elderly woman. She had other problems. No autopsy was done, so we don't know exactly what she passed from. What I want to convey here is that I'm not. I hear you, and I want to say that I understand, and I understand it as a potential fear of getting the vaccine, and I appreciate the fear that it does, especially if you know the people and they seem like they might be a person like you, either your age or have some of the same kind of medical problems you have. But I think we need to take each case separately and try to figure out exactly what happened to the person, and not just lump all the people in a group and say all these people died from the vaccine, because I don't think we know the answer to that. Some people have a severe kinds of reaction to the vaccine, and if they have other medical problems, perhaps they were exacerbated. The other medical problems were made worse or exacerbated by the response to the vaccine. That is just one potential explanation, and I would say that I don't think anyone has the answer to that question, as a whole. And we should really separate each case and approach it very individually. But it's an excellent question and an excellent thought to put out there.
Thank you, Dr. Moore. Nicholas Savai says, once vaccinated, how long are you immune from the infection?
Well, from what we know now, which is going to be changing, as you can see, they've already recommended that our most vulnerable and people with low immune systems receive a booster. How long should be, unless we find out that we're going to need it every year, which some scientists are saying that. It may become like the flu vaccine, and we just give, you get it every year if you are a person with a decreased immune system. For now, your 2 vaccines should be good. And that's just what we're doing studies on, but it's supposedly good for at least 9 months.
Okay. We have a good question from Kimberly Calhoun, Dr. Moore, are you taking new patients? And the address again is at the bottom of the screen scrolling.
Yes, I am. I'm taking new patients.
Yes,
I
you
see adults, um, and that actually is a very specific comment. So I'm meaning adults, so I don't see teenagers. Um, and you know, I love teenagers. I mean, all the patients are nice, but I'm really not trained for, you know, to see teens. So I really start seeing patients at 18.
All right, great. And make sure if you do go, mention Christian Gospel Center, Pastor Ways. Um,
Absolutely.
Dorothy
Oh,
Powell,
I'm just loving Miss Powell. She's very
yes.
involved.
Is there a
Um,
need for
there
vaccine?
may be. This is a good question, and there may be vaccine boosters for every year, but we don't know that yet. And actually, in preparation for this, I've been on a number of sites from Yale. They're doing a lot of studies at Yale University, of course, Johns Hopkins, um, the CDC, and these are questions that, and there are a lot of foreign, which I spoke to before, how the vaccines were created with a collaboration. And so there's a lot of foreign people who are studying this because, you know, all countries have been gravely affected by this. And so it looks like it may be a booster that we get every year, sort of like the flu vaccine, but we don't know that yet. But that is something that's being studied. As a sort of an aside to your comment, I think part of a lot of problem that we're having with the vaccine is that we can't answer all the questions. And I do appreciate that very much. It's sort of like if you take something that we do know a lot about, but you went to a doctor who couldn't tell you anything. So you went to a doctor and you said, okay, I have diabetes. What should I do? And they couldn't answer. Well, you wouldn't feel very comfortable with that. You know, you want to go to somebody who can answer the questions. And I think that is part of the whole vaccine issue, that the the questions are excellent questions, but no one has the answer yet, like this one. This is a very good question. And I'm thinking or leaning towards there may be a group of people who need to get vaccinated every year. And they're sort of like we do the flu vaccine. And then there may be, and maybe all of us have to get a booster. There are some people who are actually some researchers who are working on a flu coronavirus vaccine together. So that goes to show you that the answer, and no one knows if we're going to need it or not.
We can
So,
get Gail Patterson's, yes. Gail Patterson's asking, Dr. Moore, is it true that the first symptoms start like a sore throat and sinus issues?
that actually is more this Delta variant symptoms, this sore throat and sinus issues. Do you mean first symptoms of getting corona or first symptoms of after you had the vaccine? I just want to be clear.
Gail Patterson, if you can clarify, are those first symptoms after vaccination or first symptoms of the COVID coronavirus? As she clarifies that, we'll.
Okay, well, I can speak to both of them. As far as I know, that is not a symptom of receiving the vaccine. That is, now we're seeing more people with sore throat, sinus symptoms with the Delta variant, as opposed to our initial. Okay, thank you, Ms. Patterson. Where, you know, initially the symptoms of COVID, our initial COVID that we started with, were more respiratory, loss of taste and smell, fever. I think the weakness and that kind of malaise were the bigger symptoms or the first symptoms of COVID. but they are showing now that the sore throat and this sort of upper respiratory symptoms looks like they are some of the first symptoms of this Delta variant. So
right.
that is actually an excellent question.
If you have a reaction, Nick Savai wants to know, to the vaccine, does treating the reaction affect the vaccine's effectiveness or effectiveness?
No, once you receive the vaccine, it's doing its job in your cell. So no, if you have a sore arm, if you have a fever, some people get weakness, joint kind of achiness. You can use, if you are not allergic, you can use your Advil, Aleve, those kind of things. You're not going to be doing anything to that. But you don't want to squelch your immune system or your reactivity by taking it before. But if you you can definitely take it after if you if you have an effect, if you have a symptom.
John, I think there's one from Sylvester Davis that says,
Um,
can a person still catch Barbara genes? I think if they have already been vaccinated. I don't know what Barbara genes is, but can a
I
person
don't either.
still catch? Maybe we'll get clarity. Sylvester, if you give us a little more clarification, instead of shield, I think it's can a person still catch something if they have already. We'll go to Marva Swanigans. Marva wants to know, once you've had COVID, will the respiratory system ever fully recover?
Now that's going to be different for each person. And I will say out of my patients who have had COVID, I have both. I have people who had no kind of respiratory diagnoses or symptoms. They still have some. I've had people who had none and they have none. They didn't have any and they still don't have any. And then I've had people who so I think it just depends on each person, because the COVID is an inflammatory disease, which means it's just not an infection, but it causes a huge inflammation. And if you get enough inflammation in your lungs, then you sort of have to wait it out until. But I have had people fully recovered, have absolutely no symptoms. They don't take any medicine. They don't use an inhaler, nothing. Then I have others who are still using an occasional inhaler or still have some respiratory symptoms. So it's going to be very individual, which is one of the reasons why I really try to help people with how can I not get COVID, because you have no idea which COVID you're going to get. You may be one who gets a COVID and has no symptoms, or you could be very sick but fully recover, or any where along that line. And so the first thing is to try not to get it. So what can we do? Once again, we're back to our personal protection with the mask, the social distancing, the vaccine. So these are our tools, and this is just another tool in the box. But it's a good question, and I'll say yes, people fully recover, and there are some who have not. But it's still rather short. I mean, even if you had it last April, well, it's been a year, so who knows? In 2 years, maybe those people will recover. Once again, we don't know the answer to all of these questions, but I will say if I just use my own patient population, I'm going to say you could have either.
All right. Crystal Macon asks, I think, a very important question, Dr. Moore. What is the earliest age that you recommend for school-age children to receive the vaccine? Now we're at the time of going back to school.
Mm-hmm. Well, I have followed the CDC's recommendations for pretty much everything that I have done. I think even the vaccine manufacturers, we have only tested children to age 12, and I would say that is the youngest that they should get it. I would not recommend that children under the age of 12 receive the vaccine. Age 12 is the earliest.
Okay, now Josephine also going to test my medical knowledge and my vocabulary. If allergic to polyethylene glycol, are you exempt from taking Pfizer and Moderna?
Um, yes, but with the caveat, now what is your allergy? If you say, um, let's just say yes. Yes, you are. You shouldn't get that one if you know you're allergic to it. Because, even if your allergy was minor when you found out you were allergic to it, every time you test yourself with it, your allergic reaction could be greater. So if you are truly allergic to that, then I would say, yes, you shouldn't take Pfizer or Moderna because both of them have it. Actually, one actually doesn't have it, but a closely aligned ingredient that is much the same, but it's not called that.
All right,
So,
thank you. Josephine is one of our registered nurses, so she asked that from a medical perspective. Can you speak a little bit
okay.
about Longhauler Syndrome from Carol?
So what we know is that there are a group of people, and it is not been determined who and why certain people are long haulers. So you can be a perfectly healthy person with no underlying diseases and no underlying risk factors, and you get the COVID-19 infection, and you have what is called the Longhauler Syndrome. And what that means is these are people who are still, long after their infection has resolved, are still sick, not requiring a hospital, but they do have a lot of symptoms that prevent them from being participants in their daily lives. They are fatigued. That's been the biggest thing. A lot of them have a lot of respiratory symptoms, as someone spoke to earlier. They have problems with concentration, problems with their joints. Some of them have a lot of musculoskeletal complaints. And this keeps them from, they're basically people who are someone disabled. And some of them have fatigue where they can't do their job. They can only maybe move around for an hour or two, and then they're so fatigued they have to actually take to the bed to regain some of their strength. These patients are actually best cared for in a multidisciplinary approach. There have been a lot of COVID rehab programs where you have programs that help you with your memory, your concentration, and all of those things. And then they also have disciplines that help with your endurance, getting back some of your strength, working with you in a physical therapy sort of ways. But once again, this is why I say our best bet is to try to prevent getting COVID, because you don't know, and there's no way to predict who's going to be a long hauler. And like they have taken the sickest patients, and a lot of them recover and don't have it. And then from those who were very healthy to begin with, and they got it, ended up being a long hauler. So this is what we know right now. Once again, there's no actual treatment for long haulers, but they're just treated by each symptom.
Thank you. Sharon Lundy asks, what would you say to the African American community who equates the COVID-19 vaccination to the Tuskegee experience? This speaks about the whole genocide effort also.
Actually, Miss Lundy, I actually was surprised that it's taken the congregation that long to come to this question, or at least to bring up the issue. And I'm very happy to speak on it. What I can say is really a lot of, I have a lot of comments about it. First, I understand the equating at all to any kind of, didn't have to be Tuskegee. That's just one that's well known. But I'm sure there are other incidents where the African American community, and I can't name them, have not been treated particularly well in regards to our health. Where I think the differences are is this is not an experiment. So that was a study, and this isn't a study. This is a treatment. So that's a difference. The Tuskegee experiment withheld a treatment, and we are offering a treatment. I think there's enough people like myself. When I say that, I mean people in medicine, people in science. As we know, it's African American female who was one of the top researchers in getting the vaccine out. And I think there are lots of people who work in these and who have positions of oversight to protect us from these kinds of problems. I also feel that the same vaccine that I got, which I was in a group which happened to include many of our Caucasian persons, they got the same vaccine I got. So if there is an issue, I'm sitting there, I'm just the next person in the row. They didn't go and get another vaccine to give to me. I'm not sure how they're going to be able to separate ours out and only give it to the African American community, the one that is the, how should I say, the one that's tainted or the one that they're trying to study. So I think there are a lot of differences, but I understand how we can understand how and understand why. And I'm going to say this is the thing that we should hold those who can be accountable to their feet to the fire, that this isn't the kind of thing that's happening. And I think there's enough people, like I said, in oversight positions, in positions of research, scientists involved in all of this to help us to feel more comfortable, but we still have to remember our history. And I think this is a perfect time for us to continue to evaluate. But I was waiting on someone to ask me about that because it always comes up. And kudos to you for, bringing it to the forefront.
All right. VL Powell wants to know, why do people still get the virus who have been vaccinated?
So the virus, the vaccine is only 94% for Moderna and 95% effective for Pfizer. And I think 78%, I believe, you guys can look that up, but don't quote me. I know it's in the 70s for the Johnson & Johnson vaccine. So that means there is a 6% chance that you aren't immune for one, and a 5% chance for the other, and then a 29% chance or so for 21% chance for the other vaccine. So that is, that's one thing. So it's not 100%. It is what we have, but it doesn't mean that if you get the vaccine, you're going to automatically 100% never get it. Now, if you remember when the vaccines came out, what they said was, if you get the vaccine, you can still get corona infection. You should not be ill, and you should not be in the hospital, and you will not be a terminal case. So we were never promised that we wouldn't get the virus. That was never the end to that we would not get the virus. But like I said, and then of course there's going to be those breakthrough cases still, because it's not 100%. It's only 94, 95, and 70. I'm thinking it's 79% for the other vaccine.
All right, Gail Patterson wants to speak on the drug ivermectin veterinarian people are taking for COVID. Thanks.
Well, I'm just going to say don't take it. I really don't understand why anybody would take a drug that's for a horse.
Right.
Actually it's a medication for worms, but it's used in the veterinary practice, usually for horses. I'm not sure why anyone would be taking it. Even if you don't know anything about medication, why would you take a medication that's for another genus? And as far as we're concerned, we're not like a horse. Unlike we have some ties to like the chimpanzees and things like that, we don't really have any genetics that are similar to horses. So I can't tell you how. I don't know why anyone would want to use that. I will say this, I have read some literature about the amount of people who were poisoned and have been calling poison control in the States, where people are taking it in mass. So I would say don't take it. And if you're afraid to get the vaccine, which has been studied, why would you be okay to take ivermectin, which hasn't been studied at all? I don't know why that would be your choice. But that's about all I can say about the ivermectin.
Thank you. Deborah Walker Pleasure wants to know, why is it that people who are fully vaccinated catching COVID are being vaccinated and passing away? I have seen 3 patients pass away.
Okay. I'm going to assume all these people passed from COVID, since you said you've seen people pass. So once again, I don't know if the people were immune, because we do know that there are people who are not going to be, they got the vaccine, but they didn't make enough immunity, which is why there's talk and discussion about the booster. So perhaps these people were part of that group where they didn't make enough antibody, so they're as vulnerable as people who were not vaccinated. And the passing away obviously means they contracted perhaps this this horrible variant, which is very aggressive, and that was why they were it was a terminal illness for them. I don't think that the vaccine is going to be sort of like a pie in the sky. It's going to be part of what you do to protect yourself. And it isn't going to be as we have been shown, it's not going to be 100% in probably in anyone. And then, there are other mitigating factors. I don't know the people that you were with, but that do they have other health problems too? Would they be in a group that was not a group whose immunity might not be good? There are some studies suggesting that people who are on dialysis are not producing the antibodies that we would like to see. People who have had transplants, particularly renal transplant patients. So there's a lot of factors, but I don't, by no means do I think that I'm 100% safe and I can just do anything because I have had the vaccine. I think we are going to see more of that as well, what you described. It is not a panacea. It's what we have right now, and hopefully it's going to get better.
All right.
Wonderful. I'm glad to hear that about hypertensive care. Excuse me.
One question that personal, and I guess Sister Hempfield doesn't mind. I'll read it as she wrote it. I'm age 77 and enjoy walking on a track in a senior center. If I'm alone, should I wear my mask? How concerned should I be if there's one or two other persons on the track with me?
If you are alone in that room and you have been vaccinated, I would say no, you don't have to wear your mask on the track. However, you should wear your mask as you enter the center and pass all the other persons who you might meet if you have to catch the elevator or as you walk through the hallway. If there are other people on the track, I would suggest, yes, you wear your mask, even if there's one or two, because you don't know if they've been vaccinated. And you also don't know if they are people who may have early infection, just they're not sick yet. So anytime you're inside, I'm assuming this means inside. It says walking on it says in a senior center. Yes, so you're inside. Yes, if you are inside, you should. And the one or two other people, the other significance is that whenever we're doing anything that causes us to increase our respiration, so as we talk, as we sing, as we exercise, we are more respiratory expelling is going on. So you're expelling more things from your respiratory tract as you talk, sing, walk, run, exercise. So if you're inside and you're by yourself, no. But if there are other people on the track, then I would suggest, yes, you wear your mask.
Dr. Moore, you have been wonderful. One last question. This will be the last question. Is there a way to test immunity levels after being vaccinated?
Yes, and the test that I'm familiar with will just tell you if you're immune. There are studies, however, if you want to know levels, there's everybody's doing a study. I'm sure you can find one if you're interested, where they're probably going to do a better job at telling you a level of immunity. It won't just be yes or no. But if you just want to know if you are immune, you can have an antibody test, and it'll tell you if you have antibodies or not. But it'll just say, yes, you have them. No, you don't have them. But I would encourage, since you brought that up, more of us to participate in these studies where they're checking levels. Let's not assume, once again, that we're all the same and that your response as a female is the same as a male, or the response of a 70-year-old is the same as a 20-year-old. And let's be part of the answers to the questions and not let the answers be for the people who were in the study, which would be mostly our Caucasian counterparts, and then let us just extrapolate or use their information for our people, which is not always the same. So I'm glad you asked that question. I would encourage people to involve themselves in those things. And I think that's another way to go back to the issue about the Tuskegee experiment, for us to stay in the forefront of what's happening now, and for us to be a part of the answers. And for people who may be concerned about being in a study, generally with these studies for immunity, they're going to be taking information, be it blood or oral or nasal testing from you. So they won't be giving you anything if that's a concern of yours, that you may receive something that's, that's not to your, that's not appropriate. They're going to be asking you for your blood or your sputum or nasal swabbing, but you won't be given anything. But I think that's a good question, and also a way to be a participant.
All right, we're going to wind down with the questions. Let's see. Let's see. We'll take the last two. One, Denise Reese, how important is the booster shot? She's addressed that after we have been vaccinated, or after we have been vaccinated. Could you elaborate on that?
Well, I think the booster is important in certain populations, which is how they initially thought we would use the booster. So our elderly, immunocompromised, they meaning the CDC, started out with, we're going to booster certain populations. However, it looks like it's going to come to, we're going to booster people who have been about 8 months out. If it's offered to you, I don't think it would hurt to have it. I'm not sure all of us need it, but it's easier in you do population medicine, which is what we're doing with this, not to individualize. So if it's offered to you, I think we can get it. If it's only offered to those who, let's say, and they have not said this is my comment, there's going to be some kind of shortage or something like that, then I would imagine they're going to relegate it to communities that are going to be are immunocompromised. So once again, we, as I spoke before, we have our dialysis patients, a kidney transplant, or pretty much any kind of transplant. We're going to have our immunocompromised people who have autoimmune disease, people who are getting chemotherapy, people who are the extreme elderly. Those are going to be the people who are really going to benefit from the booster. And then if it's offered to everyone, certainly I would, if there's no shortage and we're going to be vaccinating our whole groups, I would say absolutely, get it. Before we have more people infected, as I said before, the more people infected, the more chances for the coronavirus to mutate or create a new variant, and perhaps our vaccine isn't strong enough for the new variant. We don't know what that will be. We'll pray that this is going to be the strongest and most aggressive there is, but we don't know the answer to that either. So that's the answer for that.
And the last question is from Kimberly Calhoun. Can you take vitamins to boost your immune system against the virus?
There's been some evidence about vitamin D being, that's basically the one that's been the most scientific evidence to show a good optimal vitamin D levels are protective. Vitamins in general, it takes a long time to boost the immune system. I mean, we're talking years, not months. And there's no particular way to to boost your immune system against this virus. You just want to have a better immune system. So in general, I think vitamins are good, but what I really would like to see our communities do is control our underlying risk, not be the uncontrolled diabetic, not be the smoker or the patient with uncontrolled asthma, not be the hypertensive that's uncontrolled, and not be the, as we know, people who are overweight are also, that's a risk factor for, you're considered a risk for contracting the virus, at least the older one. This appears to be, the Delta one appears to be affecting those. So that's what I would like to see us do as a community. The vitamins are good, but we don't know how long it takes for them to do it, with the exception of the vitamin D. But if we can decrease our risk to get COVID in the first place, I think we'll do a lot better. And those are things we already know how to do. I mean, those are not new. That doesn't, and it doesn't, doesn't take you to learn any kind of new thing. We already have the information. We just need to get on board with getting that controlled. So I think we'll end it there. Pastor?
Dr. Cheryl Moore, you have been absolutely fantastic, and you've been certainly informative. You've been clear, you've been precise, and you've been helpful. There's a plethora of thank yous that are in the comment sections from many of the onlookers, and I too personally, as pastor of Christian Gospel Center, want to thank you for sharing your time, your expertise, your knowledge, and doing it in a way that has certainly been a great advantage to us. You have inoculated us with with practical knowledge as to how to navigate during this time, and we're thankful for you and for you spending your time. Thankful for Carol Walker, who made the who introduced us, made the introduction, and brought you here. And certainly, on behalf of our church, we want to thank you, and we certainly, you'll hear from us, and thank God for your being willing to share and impact. Again, she has her own private practice located at 6001 West Outer Drive in Suite 205 here in Detroit, not far from here. 313-966-9521 is Dr. Moore's address. It's health and wellness practice. Certainly, if you are in need of she again is a certified internist, a family physician, practicing physician for a good length of time. So if you need a personal physician, certainly she has made it aware that she is open and receiving new patients, and make it your business to use her. Again, a lover of God, a woman who loves her community, her people, and who also is a believer. Thank you again, and thank you for listening.
And thank you, to you, Pastor, of course, to Carol, and also to your congregation, just for allowing me to, speak with you. And I've learned a lot just from the questions. Hopefully, I'll be able to take some of the questions they asked back. Sometimes the patients don't necessarily ask me, but this will give me some things I can bring up to them, since I learned so much from your congregation. This is a wonderful program that you have here on Wednesday. And now that I'm familiar with it, maybe I'll pop in sometime and I'll get some teachings from you. I appreciate that very much.
Thank you. And certainly we're lifting up your pastor, Dr. Nicholas Hood, and again, the loss of his brother and which is Steve Hood, phenomenal individual, well known in the community, and we're praying for them. I want to pray for our own beloved sister Lillian Brantley, who yesterday her husband made his transition and went into eternity. So pray for Sister Lillian Brantley as she goes through the grieving process of her husband. And God bless each of you. Once you share an offering, you have means and mechanisms for sharing. You know the 3 ways to give. And I want you to do that via your technology using PushPay, Cash App, and or mailing it in via U.S. Postal Service. This has been a wonderful Word Wednesday.
Thank you so much.
God has sent through this vessel who He has anointed and given opportunity. Jesus used and sent persons that He healed or that He prayed for to the appropriate authorities, scientific authorities. He sent one to the Levites, to the priests. He sent one man to a pool of Siloam. He sanctioned the knowledge that God gave and has given to those who are adept and able to practice medicine. And so healing is always of the Lord, but God uses many means and many tools and many persons. And He's gifted us with Dr. Moore as a tool and gift of His to share and help in the healing process. Thank you all for tuning in. Look forward to Sunday coming, if the Lord delay is coming, and then next Wednesday for another wonderful Word Wednesday. I pray blessings upon you and your household and all of yours. And thank you for listening. Now, God, as we leave this place and this space, I bless the home and the life of Dr. Cheryl Moore. And as she has given to your people and given out of her expertise, will you reward her abundantly so and touch her and bless her, give her health, long life, peace, resolve any and every issue. Let your grace be extended. We pray for the Hood family, pray for the Sister Lillian Brantley, God, who is in grief tonight, and touch her and comfort her and strengthen us all until we meet again. In Jesus' name, amen. God bless everyone. We love you.